Hello, Ray Thomas, President of Qualys Management here to help you understand the complexities associated with your DME costs. I've spoken with hospices who lowered their DME vendor fee schedules by 10% or more, only to have their costs remain the same or increase over the next 12 months. How is this even possible? Well, it helps to understand all the variables that affect your DME costs. Vendor fee schedules only represent about 60% of DME costs. Other factors include DME utilization and ordering patterns, clinical team ordering efficiencies, patient acuity, and outside factors such as referral sources. So once you've negotiated the best possible fee schedule, you will want to craft an action plan to address the other factors that account for 40% of your DME costs. Let's start with DME utilization and ordering patterns. When surveying hospices, we learned that clinical staff experience very little, if any, DME training when earning their education. As a result, their local vendor typically trains them on DME. Furthermore, vendors themselves receive little formal training. They are educated by the manufacturers. Both vendors and manufacturers are incentivized for your hospice to order more equipment, not necessarily the exact equipment needed. Utilization patterns with DME that are not medically necessary or using higher cost items when more cost-effective alternatives are just as effective can lead to higher costs. Let's move on. Clinical team ordering efficiencies. Another way to control costs is to order appropriate equipment at the initial assessment whenever possible. Sometimes it is unavoidable to order a bed on a Monday and a nebulizer on Tuesday and a wheelchair on Wednesday, all for the same patient. But it does ratchet up your costs as your vendor must make multiple trips when one would have sufficed. Ordering more DME than is needed on the initial visit is not an effective way to resolve this issue, even if you have a per diem arrangement with your vendor. There is always an associated cost, either now or later, when vendors must make multiple trips to service the same patients. Patient acuity. Obviously, high patient acuity leads to high costs. Patients who need expensive equipment like ventilators, cough-stimulating devices, BiPAP STs, and electric lifts. Another piece of this puzzle is your median length of stay. Patient churning, usually the result of brief lengths of stay, often means getting patients late in the hospice cycle, so they need significantly more DME, further ratcheting up your costs. We'll complete our discussion on DME cost factors in a follow-up DME in 3, delivered by your friends at Qualys, the home of heartfelt, intelligent DME.